Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment of a disease known as ED, which is the full form is erectile dysfunction. In simple words, it is also known as impotence. Let's proceed with the main description of the disease. Now, the definition for this disease is ED is defined as an inability to get and maintain erection of the penis firm enough for sex. It is important to note that ED may happen even in normal persons from time to time. So a normal person, if he gets this, he need not worry, it will pass away. Of course, you have to see whether there are some real reasons for that. Depression, stress, anxiety, relationship issues, physical or mental exhaustion, worry, financial and emotional issues, all these can cause ED either temporarily or on a long-term basis. Now the medical causes of ED. Medical conditions which can cause ED are diabetes, heart conditions, high cholesterol, high blood pressure, prostate surgery, radiation treatment of cancer, trauma, medications for pain control, medications for blood pressure, and also medicines for allergy as well as for depression, and the use of illegal drugs, tobacco and alcohol. Now what results from ED? ED can cause an unsatisfactory sex life, stress or anxiety, embarrassment or low self-esteem, relationship problems with the partner, and possibly infertility. Now, how can ED be prevented? ED may occur as a normal and routine part of the aging process. However, several steps can be taken to prevent ED. These include 1. Regular checkups and medical screening. 2. Treat medical conditions for physical, emotional and psychological issues. 3. Consider the option of stopping, reducing or changing ED causing medications. This has to be done strictly with medical advice. 4. Exercise regularly. 5. Maintain optimum weight. 6. Stop smoking as well as stop the use of alcohol and illegal drugs. 7. Control stress. So these are the ways in which you can prevent ED in the natural course of your life. Now what is the conventional treatment of ED? The standard and conventional treatment of ED is as follows. 1. Treat the known cause. 2. Increase nitric oxide using medicines like Viagra. Of course, this is strictly with medical advice. And such medicines you should know that these are contraindicated in patients having heart disease, heart failure and low blood pressure. 3. Injectable medicines. These have to be injected directly into the penis. 4. Urethral suppository. 5th. Replace the testosterone. 6th. Use of penile pumps. 7th. Penile implants. 8. Exercise. And 9. Psychological counseling. These are the conventional allopathic treatments of ED. Now what are the natural treatments for ED? ED can be treated naturally with the help of 1. Diet. This includes fruits, vegetables, nuts and fish. 2. Exercise of moderate to intense activity about 4 to 5 days a week. 3. Good quality sleep for at least 7 to 8 hours daily. 4. Lose weight and maintain weight at an optimum level. 5. Maintain positive health and good self-esteem. 6. Sex counseling. 7. Stress management. 8. Reduce or stop alcohol intake. 9. Stop smoking completely. 10. Adequate sun exposure, or then you have to take vitamin D supplementation. 11. Again, ensure adequate zinc intake in your diet or take zinc supplements. 12. Inculcate the habit of nasal breathing. It is believed that this nasal breathing increases nitric oxide in the body. Now these are the natural treatments for ED. So what are the Ayurvedic herbal treatments of ED? The Ayurvedic treatment of ED can be in the form of local application or oral medications. So what are the local applications? These include oils or ointments of medicines like Jyotishmati, Lata Kasturi, Jaifal, Lavang and Tejpatta. These medicines have a stimulant effect which causes vasodilation when applied to the penis and help in maintaining erection. Now the oral medications. Now these include several Ayurvedic medicines which have different modes of action in treating ED. These include herbs like dalchini, adrak, methi, kesar and fruits like anar. All these have blood thinning properties. they reduce cholesterol and they increase the blood flow in the arteries. Now second, these are herbs and foods which increase testosterone, and these include ashwagandha, gokshur, safed musli, shatavari, shilajit, cronch beej, also carrots, beetroot and spinach. Now the third category is these are central nervous system stimulants. These act on the nervous system and increase sexual desire. These include medicines like Shilajit, Vardhara, Shuddha Kuchla, Abhrak Bhasma, Kasturi and Vanga Bhasma. Now the fourth category is nervous system sedatives. These reduce anxiety, stress and relax muscles and help in ED. These include medicines like Brahmi and Jatamansi. Now the fifth category is of nervous system stabilizers. On a long term basis, these medicines help stabilize the nervous system and therefore help with ED. Medicines included in this category include Suvarna Bhasma, Raupya Bhasma and sindur. Now some well-known Ayurvedic formulations which belong to this category are Brihat Chintamani, Brihat Kasturi Bhairav Vasant Kusumakar Ras and Trivang Bhasma. Now it is important to note that all the above mentioned herbs, they have therapeutic actions at multiple levels, and they also may have short acting action properties as well as long acting properties. So they can be used in multiple modes. Now with all this description, there is a short disclaimer. Avoid self-medication. Do not stop or change medication without medical advice. Take treatment from qualified and experienced physicians. Now even for Ayurvedic medicines, take advice from a qualified and experienced Ayurvedic practitioner. Use good quality medicines and herbs and avoid taking herbal powders of undisclosed content or from unreliable sources. So friends, this is a short description of ED, the causes, the different types, the conventional treatment, the natural treatment and the Ayurvedic herbal treatment for ED. So let's meet in the next video. Goodbye.